Now, 3/4 of South Africans might want the COVID-19 vaccine, but the country has been relatively slow in rolling it out. To discuss this and South Africa's overall response to the pandemic, I'm joined now by Professor Reza Daniels from the University of Cape Town. Prof, good afternoon. And there has been some survey done that's showing that, 3/4 of South Africans want to get the jab. We've also heard there's been a bit of vaccine hesitancy, but now we are in phase 2 of the rollout, but only a small percentage of people so far have received it. And we know from what we've heard from Dr. Mkhize, the health minister, they're still waiting, hopefully to know by tomorrow if the American FDA will have completed the audit of Johnson & Johnson so we can get more vaccines.
Yes, absolutely. And thank you so much for having me. So the survey that conducted an analysis of whether people will accept the vaccine if it were available is called the National Income Dynamic Study, Coronavirus Rapid Mobile Survey. And we did find that, in fact, 71% of South Africans do want to take a vaccine. But of the 29% who said they were vaccine hesitant, we found that there were 3 main reasons for that. And that was, firstly, that people were worried about side effects, and about 31% of those who said they were vaccine hesitant stated that as their main worry. 21% said they did not believe it was effective, and 18% said they did not trust vaccines in general. So we do have a little bit of an uphill battle to ensure that we get enough of the South African population vaccinated and we overturn some of that vaccine hesitance. Thank you.
Yeah, when did this you do this study? I'm just asking this just to share with our viewers, because there's also been complaints about the kind of information that's being disseminated or access to the proper information that can be trusted around helping people making a decision whether or not to get the jab.
Sure. So we conducted this version of the NIDS-CRAM survey between the 2nd of February and the 10th of March 2021. It was a telephonic interview survey, and it was asking people about whether they would want to accept the vaccine then. But the survey is part of a larger survey, the NIDS-CRAM survey, which has been going since March of 2020. And it was designed to try and assess the impacts from both a social and economic and health perspective of the lockdowns associated with COVID-19. So this is the 4th wave of data that we just released last week, Wednesday. And for the first time, we asked questions about whether people would use the vaccine. So that's what we got data on for the first time in 2021.
Yeah, in terms of the vaccine itself. But the impact-wise, pandemic-wise, since last year, have you seen some shifts? What could you highlight? What has your survey found that is now standing out, if at all? What are the highlights?
Okay, so some of the other highlights, other than the vaccine work, is that effectively, once we went back into wave 3 lockdown in the end of December through to the end of Feb, we did ask people about what happened to the employment situation, and we saw that there was a reduction in employment from 55% to about 52% during January 2021. So what we're beginning to get a very good idea about with respect to employment is when each of these lockdown regulations are introduced, how does that impact upon our population, and just how vulnerable are certain age groups, certain jobs, occupations and industries, how vulnerable are they to these lockdown regulations? We did also find that there was some impacts on hunger. So that's another key socioeconomic outcome that we're monitoring in the survey. We found, in fact, that when it came down to looking at child hunger, household hunger, and whether there was food money for everyone, there was a slight reduction from October last year. In other words, fewer people are reporting that they did experience hunger. One of the big concerns there is that the grants that have been supporting people, the specific COVID grants, for example, will be phased out.
Well, they've stopped.
May.
Yeah, they've currently stopped. So thank you very much for sharing some of the highlights with us, Professor Daniels there from the University of Cape Town about that latest research.